I really appreciate you doing this.
No problem.
And pretty much, I mean, this is Glossia for Alpha 1, but you could pretty much do this for anything, right? I mean, the
Yes.
setup is kind of the same.
Right. Now there may be, like some of them may not have the filters
Yes.
that you use, but we can also use the filter needles
Okay, gotcha.
instead of the actual like green filter.
Gotcha. That makes perfect sense.
I'm gonna lay all these needles out too because they may see them all and wonder if they have to use a separate one, but I can show in the video that they don't have to.
Yeah, well, that's fine. Just whatever is the easiest way. A lot of people are kind of intimidated. I've heard a lot of people say that you have to almost have a doctor to be able to do an IV, and it's like that's just not true. As long as you're properly trained, you know, RNs can do it. I mean, honestly, there's some infusion companies now for people who are, you know, kind of like having inclement weather and stuff.
Right.
They'll train the person to self-infuse in some locations in some
I've
states.
trained people to stick themselves in self-infuse.
Yeah, I mean, you know, a lot of people think, well, it's like, well, you know, if I don't do this just right, I could, you know, end up getting an infection and dying. And it's like, it's a lot more dangerous with a portacath,
Right.
with a central line than it is actually with a peripheral. I mean, as long as you sanitize the area properly, it really
Right.
doesn't make much of a difference.
Now I'm gonna get this stuff out for your IV.
Sure, thank you. I really appreciate it. And I did put a bag there if you need it.
Oh, thank you.
It's okay.
That's probably got everything in it that I need.
I think so, probably.
Drip. That's your bag.
Yep.
Syringe. Filters.
Mhm.
Start kit.
Now, do you normally use all these same kind of components normally for any other type of medical infusion? So you would basically filter it both ways. You would use a mini spike to make the venting easier to pull the medication and things. If you didn't have a mini spike, for instance, you can do it manually, but it's just a lot harder to pull it up through, right?
Right, you could do it through like an 18 gauge. You wanted to use a large gauge needle.
Right, gotcha. That makes perfect sense.
Just because it can also, if you don't use a big enough gauge,
Uh-huh.
you don't want to take a chance on damaging the medicine by pushing it through too small
Yes,
of a gauge and needle.
gotcha. That makes sense.
And we always have to have your IV access before we can actually mix your drug because,
Just because of protocols and everything.
right, and it's so expensive, it's only stable after mixed after pulled out of the bottle for so many hours.
Right.
And we just want to make sure we have access to get that.
Sure, that's no problem at all. I know this particular medication is very expensive.
Right.
It's like, if I count it up, I think it's like $10,000 a month. Or
Wow.
actually 10,000 a dose. I think I counted it up to be 250,000 a year. However, of course, we don't pay that out of pocket. You know, the
Right.
providers and things, you know, take care of that. And that right there is an Invocan catheter, right? It's,
Correct.
is
It's
that what-
24 gauge.
24 gauge. Gotcha.
The actual brand, it's a Intercan Safety 24 gauge.
Gotcha. Okay. And you can pretty much, like say, when you're accessing, you can use those. You can use a standard one that has a cover over it. There's a lot of different ones you can use to access veins, right, and stuff like that. But that's the most common one right there.
Correct.
that's used.
Yes. That's what we use in our company.
And the
Unless, of
kits-
course, they have a port.
Right, of course. And then you would use a Huber needle.
Correct.
And these little starter kits, they pretty much have all your prepping area and stuff, or all your prepping supplies inside, besides just the standard alcohol. You have a
And
tourniquet,
saline, yes. And gloves.
gloves, yes.
A drape.
A drape.
a Tegaderm,
Tegaderm.
iodine,
Iodine.
alcohol, and the gauze.
Gotcha.
Okay, so where do you want to sit for your
For my
to
sticking.
start your IV?
I see what I'm gonna do. I'm gonna go ahead and end this video, and I'm gonna start a new one, and then I'll take and I'll start off with the sticking, and that way it won't
Okay.
be too big. Okay, be right back.